The next topic is types of diseases. So, the diseases are classified into two types. One is congenital diseases, the other one is acquired diseases. Then, what are congenital diseases? So, these diseases are present by birth. So by the time the child is born, the child will be suffering from that particular disease, and mainly these diseases are caused due to genetic problems, and generally these diseases cannot be cured and they can be passed on to the next generation also. For example, you can take hemophilia, color blindness, and then cleft lip, abnormality in the heart. So all these comes under congenital diseases. Whereas acquired diseases, so these diseases are developed after the birth during their lifetime, during one person's lifetime, and these acquired diseases are classified into two types. One is communicable or infectious diseases, whereas non-communicable, second one is non-communicable and non-infectious diseases. So infectious diseases. So generally these infectious diseases are caused by pathogens. Like already I said, viruses, bacteria, protozoa, fungi. So infectious diseases can be caused by pathogens and can spread from one person to another person by physical contact, direct contact, water, air, food. So, since these diseases are communicated from a diseased person to a healthy person, they are known as infectious diseases. Then second one is non-infectious diseases. These diseases, generally they are called as metabolic diseases. The non-infectious diseases are restricted to the particular individual, to that person only. So they do not spread from one person to another person. So non-infectious diseases, generally they are caused by degeneration of tissues in the old age people. So then we call them as degenerative diseases. If suppose generally they may be caused by lack of certain essential substances in the diet, then we call deficiency diseases. Then uncontrolled growth of tissues in any part of the body, that is cancer, and defects in metabolic reactions, then they are metabolic disorders. So here are some infectious diseases or different pathogens which causes these infectious diseases. The first one is a virus disease, common cold, influenza, measles, mumps, poliomyelitis, rabies, smallpox, chickenpox, yellow fever, AIDS, etc. So second one is bacterial diseases, cholera, typhoid, tuberculosis, diphtheria, pneumonia, syphilis, gonorrhea, leprosy, etc. The third is rickettsia, typhus fever, tick fever, protozoa, malaria, amoebic dysentery, sleeping sickness, fungi, ringworm, athlete's foot, then worms, filaria, ascariasis, cysticercosis, then mites, scabies. Then there are different ways how these infectious diseases can spread. So the first method is direct transmission and the second method is indirect transmission. So indirect transmission, pathogens are transmitted from infected person to healthy person directly without any intermediate agents. That means through direct contact. So the first way under direct transmission is direct contact. So in this method, the person's skin to skin contact or mucosa to mucosa contact or skin to mucosa contact can cause the disease. So for example, chickenpox, leprosy, then through droplet infection. So in this way, in this method, when an infected person coughs, sneezes or spits, the droplets from him may directly enter into the in a healthy person. So at that time, that droplets make him sick, or the organism that is present in those droplets make the healthy person sick. So, for example, diseases like whooping cough, tuberculosis, etc. Then contact with the soil, like bacterial cysts of tetanus can infect the person. Then the animal bites rabies virus. So this virus enters the healthy person through dog bite. Then transplacental transmission. The viruses of this German measles, AIDS, and syphilis bacteria can be transmitted from maternal blood, that is mother to fetus, through placenta. Then under indirect transmission, generally these disease causing organisms enters the healthy person body indirectly. That means either through infected food or water, or through any carrier like mosquito, housefly, rat, or through clothes, towels, handkerchief, or personal utensils of the patient, or even through dirty hands or using dirty utensils or contaminated utensils or unwashed fruits, consuming these raw fruits and vegetables. Then moving on to treatment, um, the treatment can be done in two ways. That is, first one is reducing the symptoms. Then the second one is killing the infectious agent. So first one, reducing the symptoms. So here the symptoms of that particular disease, for example, you can take fever, pain, or any inflammation or any discomfort that is faced by the person, this patient has to be reduced first, and he has to make the patient comfortable. So this is done by medicines like painkillers, etc. Then the second is killing infectious agents. So this is done by targeting the biochemical pathways of infectious agents using specific drugs. So the basic concept behind this treatment is mainly targeting the biochemical pathways inside an organism. For example, if you take some antibiotics, so these antibiotics act on the pathogens at some stages to stop them producing their toxins, or they kill them directly. So it is to check their growth and multiplication. So these are the two ways in which the disease can be treated. So that is reducing the symptoms, killing the infectious agents. Then, as we already learned, antibiotics. So these antibiotics, it is been identified or discovered by Sir Alexander Fleming. So the first antibiotic discovered was antibiotic penicillin by some fungi species, that is Penicillium chrysogenum. Okay, as we already discussed, these antibiotics are some chemical substances which will act on other organisms or harmful organisms against their growth or against their infection. So this antibiotic was first discovered by Sir Alexander Fleming by the fungi Penicillium chrysogenum, and the antibiotic is penicillin. So these antibiotics are generally not effective for viruses, but they kill or stops the growth of bacteria. And why they are not effective for viruses? Because we know that these viruses have only nucleic acid and protein, but they do not have any cytoplasm or cell organelles, and moreover they do not also use their own metabolic system, but they generally depend on host machinery, host tissues to grow and multiply. So drugs are generally not effective for them. So we must say that prevention is better than cure. So why prevention is better than cure? Generally we use this term. It is because the diseases that are caused, some of them have very long term effect. So even though the person is treated, he may be bedridden. That means he might have got suffered from that disease, and moreover, or if some organs get affected during that particular disease, they cannot be cured completely, or sometimes their function is lost completely. And the next is, these persons who are suffering from the disease may also act like carriers of the disease to the healthy persons. So that's why we say prevention is better than cure. So, what are the general preventive measures? So, we already know what might be the general preventive measures. So, what is that? Maintaining personal hygiene, like taking bath, wearing clean clothes, then keeping the surroundings clean, or disposal of domestic garbage, clipping the nails regularly, using safe drinking water, and controlling the vectors like mosquitoes by spraying, by removing the stagnant water in the populated areas, and washing the vegetables or fruits before consuming them raw. All these comes under general preventive measures. But coming to specific preventive measures, that is building up of strong immunity, that is our body's resistance to fight against the diseases. It is our body defense mechanism. So one has to build up that body's defense mechanism by vaccination. So generally this is done by vaccination. And regarding this immunization technique, every one of us know that Edward Jenner, so he is the person who actually identified these vaccines. He actually developed vaccine against smallpox and the vaccination. So what is vaccination? So a vaccine is actually a small dosage of weakened organism of a particular disease. So when that dose is injected into a person's body, then our body starts developing antibodies against that particular pathogen. So whenever a real pathogen of that particular disease enters the body, these antibodies will destroy them. So this is how this immunization happens. So here are some common vaccines. So DPT, which acts against diphtheria, whooping cough and tetanus. Then BCG vaccine for protection against tuberculosis, polio vaccine, typhoid vaccine, measles vaccine, TT against tetanus, etc. Thank you.